This is an exciting time to be considering breast augmentation, implant exchange, or if you're having breast reconstruction, that as
The
well.
problem is you cannot get that level of customization, that
Mm-mm.
precision based on the 3D facial CT scan.
6 times a year. And I think it's made it difficult for patients to reach that threshold where they benefit from the rewards. And then, of course, the big controversy was
No, to be honest, I think this may be a misstep. I don't know how long this program will exist with the existing rules, the new rules, but we're going to find out.
The beauty scientists, Dr. Christy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hi, this is Dr. Roy Kim with my wonderful co-host, Dr. Christy Hamilton, and another episode of The Beauty Scientists. So today we'll be talking about a meeting we were both at, the ASPS meeting, also known as Plastic Surgery, the meeting in San Diego, California. So first off, Christy, congratulations on being the social media committee head for ASPS. That's a big honor.
thank you, Roy, and like truly thank you because you are the reason I'm in this role because you introduced me to all the big names in social media who are plastic surgeons, yourself absolutely included. And so I'm very grateful to you and very excited to lead and do great things for both like us as plastic surgeons and mainly to disseminate knowledge to our patients. So big things coming this year.
Well, it's all on you because I just, made one or two introductions. You're awesome and you're awesome on social media and you're an awesome person. So congratulations.
Thank you. And it was great to see you. I was like the first meeting I've been to for a little while after having the baby. So it was a pleasure to catch up. And there were some notable new moments. And then just like I was talking with you, some technologies that were new to me as well. Let's start with the big one. And I know we're going to do a whole in-depth episode on this, but you had introduced Motiva breast implants to me a couple years ago, talking about how they're the most popular one in numerous parts of the world, certainly Asia and also South America. What do you think about these new breast implants?
I think they're awesome. Breast implant technology doesn't really improve or change much. So this is a dramatic shift. They are calling them 6th generation breast implants. I think that's correct. And Motiva, made by Establishment Labs, huge outside the US. Lots of product or implants already placed. Huge company that's already publicly traded on the NASDAQ, so it has financial backing. We'll talk about it more, but hey, it just got FDA approved like literally a couple days ago.
Yes. Thursday last week, it was wild. And I asked them, I was like, did you guys time this? Did you just withhold the fact that the FDA approved it? They're like, no, it's all happening right now. I was like, good timing for you guys to be at a meeting of plastic surgeons when it came out. So it's new technology for the way that the gel merges with the shell and the patch. So lowest implant rupture rates on the market, lowest rates of capsular contracture, a proprietary surface, a proprietary 6th generation gel. This is an exciting time to be considering breast augmentation, implant exchange, or if you're having breast reconstruction, that as well. But we're going to dive in depth with that separately. So see our follow-up episode. You introduced me to Bistool. How did you become familiar with that facial implant company?
They are one of Asia's largest facial implant companies. They are Korea's largest by market share facial implant companies. And I just met them through friends. And I've been to Korean plastic surgery conferences, so that's where I met them in person. They have an amazing story because, first of all, they're now available in the US. They're FDA approved for standard facial implants. The story behind it is very cool. There's a plastic surgeon. He's a guy. He's the husband. He wanted better facial implants. And so he and his wife came up with better nasal ones. So since he's busy actually operating, his wife is actually CEO of the company and they have vertical integration. They actually make the implants. They don't outsource it. And their daughter, who's a young adult, is now involved in the company. So it's, technically, yes, a family-run company, but it's run by women, which is pretty awesome.
And the implants feel nice, like they have like just enough flexibility to them. And it was like chin, nasal implants, cheek implants. And then I know you said this technology is not available in the US yet, but you were saying with CT scans in South Korea, they'll do like custom, like design for your specific nose nasal implants, which that's really special because you're going to get to see how their nose is going to look and customize it exactly to their specification. That's pretty amazing.
Yeah, I mean, 3D CT scan is taken and then they can print up a custom implant for you based on your CT scan, based on your facial bones. And that's not FDA approved yet. They think it'll be FDA approved next year, but when it comes into the US, it's going to be wild. So
Yeah.
that customization is pretty awesome.
It's incredible because I know in the US that when we're doing Asian rhinoplasty, or African American rhinoplasty where we want to augment, depends of course on the nose specifics. We typically use cartilage and carve it because we don't see like implant infections with that. But I really wonder with having such great technology if silicone implants will become more popular in the US. I mean, it's pretty special technology.
Yeah, we shall see. I mean, Asians, Hispanics, African Americans have thicker skin. Even Southern Europeans have thicker skin. So in theory, it should work fine in those ethnic groups of patients. But it's just, you're right, it isn't popular in the US. We really prefer natural tissue, your own rib graft. The problem is you cannot get that level of customization, that
Mm-mm.
precision based on the 3D facial CT scan.
Yeah, so it may be worth it. And then you always have if you do have an implant infection or an issue, then you could always swap it out for a cartilage graft if it came to it. But no, it's like the upside is high.
Yes. So it's a great company. I'm glad they're FDA approved in the US for the off the shelf ones. And we shall see about the 3D custom ones, which I think is a bigger product.
Very, very cool. Our next topic of discussion is a controversy. Big controversy. It's swept the United States all over Instagram. I know they're even talking about it in the mainstream media and magazines. But the Alle Program Update, what happened?
Yeah, the old school program was if you got a treatment, you got about 200 points. 200 points is worth about $20. And so you could let it ride and build up points, or you could just, hey, next visit, get $20 off.
And
And
for our visitors, so Alley is it's Allergan, which is Botox and Juvederm filler. Also, they make the Natrel breast implant, so huge aesthetics company. So this is their benefits program.
yeah, and it was really focused at med spas and really, Botox, Juvederm. They do have skin medical cosmetics and breast implants, but I never had patients who said, hey, I want a breast implant and I want like 500 Alley points. No. I mean, everybody is sort of using it for Botox and Juvederm for the most part. Has that been your experience as well?
My honestly, Alley's not even that popular in my practice, so this controversy has not hit me very hard, but I know it's been a tipping point for some people in terms of not offering it anymore.
Yeah. So the new program, which started October 1st, 2024,
Hmm.
is you can get points, but the points don't easily convert to money. You need essentially about 5 treatments in a year to get the good stuff, Juvederm. You need 6 treatments in a year to get Botox. If you don't get 5 or 6 treatments, then hey, you get like 2, 3 treatments. Then you're going to get essentially skin medica skincare, which isn't covered by everybody. Not everybody has it in inventory. So the issue is, at least for me, the average patient's getting like 3 or 4 treatments a year, maybe 5 if they're lucky. 6 treatments a year means you're coming in 3 times a year and you're getting Botox and filler, which I don't think happens for the average patient. I don't know what your experience has been.
No, and increasingly we know that filler doesn't completely go away. So what I find is with patients, it's like if they're filler patients, we're getting them to a place where they're done. We've sculpted the cheekbones, the jawline, maybe the lips are refreshing every once in a while, maybe dissolving after 5 years and redoing them. But you shouldn't, in my mind, be coming in for filler refills twice a year in general. And then, Botox is supposed to last 3 to 4 months. So why on earth would you be coming 6 times a year? And I think it's made it difficult for patients to reach that threshold where they benefit from the rewards. And then, of course, the big controversy was this used to be a gift from the company back to patients, and it didn't affect what you or I were doing in our decision making. So we literally could do our plan, and then it was like a reward for patients. Great, that's a win-win. When they start gifting a service like a Botox treatment or a Juvederm treatment, that of course becomes very controversial because now they're stepping into our exam room. They're telling us what filler we're going to use. It may not be the appropriate filler for what the patient wants to do. And I also, like, personally, I told my rep, who I think is fantastic, but just as feedback, I was like, you're gifting our service. when you walk in, we're not handing the patient the Botox vial. What they're getting is like the expertise of, with, in your case, like expert injector doing the treatment. It's not like they're getting a free lipstick at Sephora. So maybe they could make that argument with the Skin Medica products that they're going to gift a product to the patient, in which case I think they should be shipping it directly, not to us, to then give to the patient. But I think stepping in and being part of our clinical decision making is a bit of an overreach, and I think that's been a lot of the controversy. How do you feel about it?
I totally agree. So on paper, if you're a consumer or patient, you're saying, great, I can get free Botox, I can get free Juvederm. Well, if you think about it, it's shipped to my office or Dr. Hamilton's office. Someone has to place it there. So there's liability, there's assessment. If you're a new patient,
Mm-hmm.
or even if you're an existing patient, but like it's a new anatomic area, we still have to assess you and figure out if you're a great candidate for it or not. And so Alle/Allergan actually gave in a little. They announced September 30th, right before October 1st. They put
Mm-hmm.
in wording so that patients can be charged an assessment fee, an injection fee, whatever. So I think the bad thing is that as a consumer, it's like it's free, but it's not really free. I don't know of anybody who's really going
Right.
to be injecting it for free. And
And
patients
that
can't
makes
inject
people
it themselves.
angry.
Yeah. So I don't know what's happening in your neck of the woods, but out here, a lot of plastic surgeons, med spas are strongly considering or have already dropped the Alley program.
We thankfully we're not big users of the Alley program to begin with. So I don't think it's going to impact my practice too profoundly. But like, even an interesting thing that happened was, apparently I know that an email went out from Alley to patients, because on the day before the new program started, and it said, hey, we had a patient call like, oh, I have 400 points. And then normally if she comes in, she can use that for cash back on her Botox. But so I had my office tell her, like, if you want that, you have to come like now, and I will wait for you.
Right.
Because if you try to come tomorrow, like, it's not me, it's the program, and you can't use it. And then that made the patient upset. And of course, she wasn't mad at Allergan, she was mad at my office. And it's like, I don't even know where she necessarily accrued those points, right, Roy? So like,
Right.
she could have accrued them at the med spa down the street, and then wants to come she's a patient of mine, but like theoretically they can come and then try to like redeem them with you, and the whole thing just doesn't make a whole lot of sense. So I know there's been a lot of backlash.
Yeah, I don't, to be honest, I think this may be a misstep. I don't know how long this program will exist with the existing rules, the new rules, but we're going to find out.
Yeah. So what our territory rep, who he's great, very professional, he was saying that this was born out of a conversation with, like, or maybe he didn't tell me that, but basically it was born out of a conversation between someone and the CEO of Marriott Bonvoy. And so they were trying to say about like gifting. It's kind of like when they gift rooms or upgrades, they were going to give product, because we know obviously it like what it costs for them to make Botox or Juvederm is a fraction of like the dollar amount that they're gifting. So it's like a way for them to spend less on the program. But of course, if you're Marriott, you own those hotel rooms. You're not leasing them out to somebody else. So interesting. We'll see. I agree with you. I kind of feel like this program may just go away. What else was new at the meeting for you?
What was new was a product called Alloclae, Alloclae, by Tiger Biosciences. So Tiger Biosciences makes a couple products. They actually purchased Sientra breast implants, and this product, Alloclae, is cadaveric fat. In other words, fat derived from humans. It's sent in syringes, 12.5 or 25 cc's, so you can inject fat into patients. And right now, there's a soft tissue indication, which is pretty vague, but they're thinking breast reconstruction, mastectomy patients who are thin, who don't have a lot of fat. They have irradiated tissue or chemotherapy where, hey, they need fat to get a better result. But of course, we all love fat, and we'll see if it can be used elsewhere in the body.
And 25 cc's, like, that's a lot larger amount than we typically see with a lot of these products. So that could be interesting for like non-surgical, like hip dip augmentation, or non-surgical BBL or facial fat grafting even, although I always prefer original tissues, fresh tissues for that. But that could be a really nice way to get a little bit more from the off-the-shelf products than what we see with the biostimulators or fillers that we currently have.
Yeah. And then right now, as you know, there's a product called Renuva. It's made by MTF Biologics. However,
Hmm.
it's very expensive and you can only get 3 cc's at a time. And that 3 cc syringe is crazy expensive.
Yeah. And so that's cost prohibitive when you're trying to do like, I think buttock or hip contouring would work, does work, but it's like how many, I mean, I can't even imagine how astronomically expensive that would be.
Yeah, I mean, patients are going to love this. People listing on the interwebs. To do a breast augmentation with Renuva is going to cost you about 40 to 60K retail price.
Yeah. And it's not going to be as much volume as you could get with a fat transfer.
That is correct. So,
Yeah.
hey, if there's something that works just as well with price competition, that's great. Remains to be seen with if Alloclae, like what the long-term viability is. Like, yes, fat cells are going to survive. We're just wondering, like, what percentage of fat cells are going to survive.
Yep. Just like we wonder with fresh fat transfer, and that's like the best retention you're going to get. And with body cases, high volume, sometimes anywhere 40 to 60%. That varies in literature too.
Yeah. So I know that you saw a company called Bridget, which is a scar closure system. What did you think of it?
So I've never used it before, and I've seen it on social media, but I thought it was really neat. So like these little like clips that stick to the skin, and they're applied in a way that it pushes the skin edges together and averts them, so like a little mini ridge. And that's a similar technique to what we use when we're trying to suture skin edges together. So I just thought that was a neat invention that's working off of a principle that we already know, which is that if you can take tension off skin edges, it forms nicer scars. And what they were demonstrating its use for was like at the tightest part of a breast lift closure, which is at the upside down T, or at the tightest part of an abdominoplasty. And if that's a way to get better scars in those areas, which sometimes can be thicker if it's tight, I think that's neat, and I'm going to try it out. Do you use that in your practice? Do you have any experience?
I've only tried it on a couple patients, so it seems to work. I have not used it like for widespread use, like every single patient that I have. So I know that my friends have been happy with the results. I know it's been around for at least a year or two. So we shall see if they can like grow the market and have more plastic surgeons use it for the longer scars.
Yeah, I think it's a neat concept, and I think it may, oftentimes patients just have fabulous scars just with what we normally do with our fine suturing technique and plastic surgery technique. But if you have patients that maybe you're already a little concerned about their wound healing for a couple of different reasons, or we know that they're keloid scar formers or hypertrophic scar formers, then there might be an indication for like specific patient selection for that. So we'll see.
Yeah. And it's already approved. It's available in the US and it's ready to go.
So that was the main gist of it. I think the breast implants were the big standout, and the timing was spectacular. But I'm like curious about the Tiger Biosciences too.
Yes, Alloclae, the fat in syringes, like the larger volume fat in syringes.
Yes. Yeah.
So the next meeting is in where? Is it in Austin? I think it's in Austin, Texas, I think.
Is it ASAP's in Austin?
It may be
I'm gonna
ASAP.
see you in Austin next year for sure.
Yeah. I'll see you in Austin for some meeting. That's all I remember. This is bad,
And
but
then
yeah,
New Orleans. It's New Orleans for next
that's
year
right.
for
Okay.
ASPS. Yeah.
So
Some
we're
good
going to see each
locations.
other for this meeting in New Orleans, Louisiana.
Yes, exactly. And that's going to be a lot of fun. We've done that
Yeah.
before. Yes.
So that'll be what, fall of 2025, a year from now.
Yes. And then Austin in between. And then I'm considering, because I know Baker Gordon's going away, which is another meeting in Miami, considering going to that for the first time. So maybe I can convince you to come join for that too.
And then if you ever want to go to Korea, let me know because those conferences are actually 100% in English.
I need to go with you. It is on my plan. Yes,
Sounds good.
we're doing it. So major advances in plastic surgery. It's always exciting. It's like fun to partner with industry and see what new technologies come, how we can bring the best technology, technique, advances to our patients. We're always betting to see what works and what doesn't work, and may the cream rise to the top. This was fun. Dr. Kim, always a pleasure to see you in person as well as on our podcast.
Well, it's always great to see you in reality, and it's always great to see you on video. So it's great to catch up.
Stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.